Hello and welcome to Healthy Futures, the podcast dedicated to exploring common health issues affecting children and families. I'm your host, Dr. Saeed Kazmi, and today we are tackling a topic which is familiar to almost every parent, which is the dreaded sore throat, specifically tonsillitis in children. Now, it's incredibly common. It can cause significant discomfort and it often leads to questions about the use of antibiotics and sometimes even surgery. And to help us navigate this, I'm very much delighted to welcome our expert guest today, Dr. Oluwafemi Oshin. Dr. Oshin is a renowned general pediatrician with extensive experience in general pediatrics. Welcome to the show, Dr. Oshin.
Thank you for having me, Dr. Kasmi. It's a pleasure to be here to discuss this important topic.
You're very welcome, Dr. Oshin. So let's start with the very basic. Just tell me, how common is tonsillitis in children? I mean, if you can give me a sense of the overall epidemiology, perhaps touching on the local UK statistics.
Oh, certainly. Tonsillitis is one of the most common reasons children visit their GPs. It's estimated that sore throat, including tonsillitis, account for millions of GP consultations each year in the UK. And why specific tonsillitis only, the stats will be very tricky to get to isolate that perfectly. But generally, said that most episodes occur is undeniably the major reason why children visit their GP. And most episodes are caused by viruses, about 70 to 80% of these cases. And the remainder is caused by strep, group A streptococcus, often called strep throat.
Oh, thank you very much. So, Dr. Oshin, is there any particular age group where we see tonsillitis more often than others?
Yes, it can occur at any age, but the peak is in the ages of 4 and 7 years old. Younger toddlers can get it too. Adolescents are also not immune against this, but primary school age group seems to be the hotspot for this tonsillitis, and this is likely due to exposure to various viruses, bacteria, and in nursery and school setting, combined with an immune system that is developing.
Thank you very much. Now, that certainly makes some sense. So, for those parents who might be listening to our podcast, can you tell us what are the typical signs and symptoms of sore throat and tonsillitis that they should be looking out for? Like in reality, how does tonsillitis actually look like?
Well, a classic presentation includes sudden onset of significant throat pain, often making swallowing difficult. You often hear the term adenophobia among the medical expert. Children often have fever. Sometimes fever can be quite high. And if you as a parent or the doctor look behind the throat, you see the tonsils, those two lumps in the throat. They typically appear red and swollen. And sometimes you might see white spots and patches on them. And sometimes there may be neck pain, headache, earache, and headache is usually a referred pain. Some children experience loss of appetite and generally being unwell. For those children who can articulate their symptoms, they present with freezing eyes, drooling, and refusal to drink or eat. You see them just crying in discomfort generally.
Okay, that's a very clear picture that you have just told us. Now, it sounds quite distinct, but do you think are there any pitfalls in diagnosis? Like, are there other conditions that can mimic tonsillitis?
Absolutely. This is a crucial point. Thank you for that. Firstly, differentiating viral tonsillitis and bacterial tonsillitis could be tricky and is usually challenging. Diagnosis is made by clinical signs. While features like prominent exudates, high fever may tend to support bacterial diagnosis, there's usually an overlap. It's important that this could influence the decision to give antibiotics. Secondly, other conditions can present like tonsillitis, like glandular fever, infectious mononucleosis. Yeah, this is caused by a virus called EBV virus, and it's common in adolescents, and it presents with sore throat, swollen tonsils, thick white exudate, fever, fatigue, and this is basically viral. It doesn't necessarily require antibiotics. Simple pharyngitis can also, that's inflammation of the throat without the tonsils, and also give symptoms similar to tonsillitis. And more rarely, but importantly, you see the need to consider complications like peritonsillar abscess, which is which usually present with more severe and one-sided lip pain, difficulty opening the mouth, and the hot potato voice. This needs urgent attention.
Yeah, I mean, what you have said is actually it highlights the importance of what we call as a proper medical assessment. Now, some children, they seem incredibly prone to tonsillitis. I mean, getting it repeatedly again and again. I mean, I know that we see these kids coming down every 3 to 4 weeks getting this tonsillitis repeatedly. So, what defines what we call as recurrent tonsillitis, and why do some children they suffer so much as compared to other children?
Well, recurrent tonsillitis is significant burden to some children and their family, and we see that quite a lot. Generally, we use guidelines like SIGN, that's the Scottish Intercollegiate Guideline Network criteria, which are widely referenced in the UK, and this suggests considering tonsillectomy, that's the removal if the child had 7 or more episodes or of significant tonsillitis in the preceding year, or 5 or more episodes per year in preceding 2 years, or 3 of such episodes, or 3 or more of such episodes per year in the preceding 3 years. So it's crucial to note that these guidelines are guides, and each episode should be clinically significant, which in this case we are talking about severe enough to disrupt normal function and often requiring time off school or medical attention.
Thank you very much, Dr. Oshin. I mean, what you have described is very good. I mean, you have explained the actual criteria for defining recurrent tonsillitis. But my question is, why does it happen repeatedly in some children?
Well, the exact reason why this happens, it's not clear. It's multifactorial most of the time. It might be because of persistent bacterial colonization of the tonsils. Perhaps bacteria is hiding within the tonsil structure, or this is usually called the biofilm, and making them harder to eradicate completely with antibiotics use. Individual immune system response to antibiotics also play a significant role. Some children might just be more susceptible than the other, and sometimes it is also important to rule out common cause common cause of recurrent sore throat, like a periodic fever, plus stomatitis, pharyngitis, and adenitis, which is the short code is PFA-PA syndrome, which follows a periodic cyclical pattern. It does not necessarily mean that there is an infection.
So, Dr. Oshin, you just mentioned about tonsillectomy, which I understand is a surgical removal of the tonsils. Now, when does this process become a necessary step? I mean to say, what are the main indications for tonsillectomy?
The primary indication for tonsillectomy is if a child meets this above criteria that the chair with discuss recurring tonsillitis, but this has to be taken holistically individualized. Where these episodes are frequent, they are severe enough to impact the child's quality of life, including use of multiple antibiotics, loss of time in school, missing school attendance, and parental time off work. However, there's other important indications, which includes obstructive sleep apnea or sleep disorder and breathing, where the tonsils can be big enough to, and the adenoid can be big enough to cause obstruction of the airway during sleep, causing the child to have snoring, pause of breathing, which is apnea, or poor quality of sleep. Unless or other less important uh, co- other less common reasons are previous complications like quiescing, usually after the second episodes of quiescing. And another one is when there is the risk of cancer. This is very rare in children anyway. Uh, when on-toss is slightly bigger than the cover. Although this is, like I said, this is rare in children. So the decision for tonsillectomy or removal of tonsils should be realized by the ENT surgeon and weigh the benefits and the risk of surgery.
Okay, thank you, Dr. Oshin. That's a very helpful clarification. So finally, let's talk about antibiotics. I mean, there's a lot of focus on antibiotic stewardship. Everybody's talking about that unnecessary antibiotics should not be given. So what do you think? What is the role of appropriate antibiotics in managing tonsillitis in children?
Well, thank you for this very critical question. It's important to that, as said earlier, that majority of the tonsillitis are viral. So, giving antibiotics to most of these kids will contribute to antibiotic resistance, and which is a public health concern. From bacterial tonsillitis, typically strep throat has but a throat. Antibiotics like penicillin and amoxicillin can be given to shorten the duration of symptoms slightly, perhaps about 16 to 24 hours period. It reduces infectivity and importantly reduces the risk of complications. The risk of rheumatic fever is a serious complication of tonsillitis. Being on the is now very rare, thankfully, in the UK. But antibiotics are effective in preventing it. So to help decide who might benefit from antibiotics, the GP use different scoring system like the Centaur score or the fever pace score, which assess the features like fever and absence of cough, swollen lymph nodes, or tonsillar exudate. Patients scoring higher may benefit from antibiotics and may be treated like as a possible bacterial infection. However, most often times a delayed prescription actually is engaged where a prescription is given and parents are advised only to use this if symptoms become worse or get severe. Those children with low milder scores are being given supportive treatment, mainly adequate pain relief, paracetamol, ibuprofen, and hydration.
Okay, so you mean to say that the key message is that antibiotics are not always needed and that careful consideration is required?
Yes.
Okay.
Yes, it's supportive management in most of the cases. Antibiotics is only reserved for severe cases where we strongly consider or a possible bacterial infection.
Okay, Dr. Oshin, this has been incredibly insightful. I mean, you have really clarified the landscape of tonsillitis in children, like from how common it is and what to look for through the challenges in diagnosis and the management of recurrent episodes, especially to the specific indications for surgery, and also about the judicious use of antibiotics.
It's been my pleasure, Dr. Kasmi. It's a common condition that concerns a lot of parents. So hopefully this discussion will provide some clarity.
Yeah, sure, it will. I mean, so let me summarize. So the key takeaways for our listeners are that tonsillitis is common. It's usually viral. One should be looking for severe sore throat accompanied by fever and red swollen tonsils, sometimes with white spots on them, which we call it exudates. Most of these cases, they get better with pain relief and fluids. Antibiotics are only needed for suspected bacterial cases, while recurrent severe episodes might warrant discussion about tonsillectomy with the GP or with the ENT specialist. And most importantly, if the child is very unwell, struggling to breathe or drooling excessively or is unable to swallow fluids, then the parent should seek urgent medical attention. A huge thank you again to you, Dr. Oshin, for sharing your expertise with us today.
Yeah, thank you.
And thank you also for our listeners for tuning into Healthy Futures. Join us next time for another discussion on child health. Until then, stay healthy, stay safe. Signing off. Bye-bye.